Elastomeric Devices, Monitoring Impact. This short presentation gives an overview of the processes needed to be able to monitor the impact of the service on an ongoing basis. It is important to have a robust method for monitoring and demonstrating the impact of the service on both patients and the health economy. As highlighted in the governance presentation, it is crucial to have a process for monitoring the outcomes of patients during their treatment. For example, through daily observations, weekly blood tests, and MDT review meetings. Services should also monitor the overall outcome of treatment, such as course completed, patients readmitted, or medications changed. This will help the service to identify any trends and review patient selection if needed. The table shown is an example of the data gathered by OUH and includes the condition treated, treatment given, and how long patients receive treatment via an elastomeric device, and the overall outcomes. This table also enables the service to provide activity data that will be discussed shortly. Patient feedback is also an important part of monitoring the outcomes of the service, and this is covered in a later presentation.
To demonstrate the impact of the service for the Trust and wider health economy, activity and finance data will be key. For the activity data, this will include the number of patients being discharged on elastomeric devices, the number of devices used for each patient, and the number of bed days released. It is straightforward to calculate the number of bed days saved per patient. This is the total number of elastomeric devices used by that patient minus 1. 1 is subtracted to account for the first device being administered in hospital on the day of discharge. However, please note that this is based on the model at OUH, and you may need to amend this based on the service model your trust adopts. Once you have the number of bed days released, you can then calculate the cost avoidance. This is calculated per patient per bed day saved and will vary from trust to trust. This is because each trust will have their own bed day cost and staffing costs for service delivery. Your finance team will be able to help provide these figures. Based on the OUH model, the cost savings are calculated by subtracting the service costs from the bed day cost. The service cost includes the cost of the elastomeric device itself, the cost of the buffered saline needed to reconstitute the drug, and the staffing cost. Staffing cost includes travel time as well as the time spent in the patient's home. Drug costs are not included, as this is incurred regardless of whether the patient receives the drug in hospital or at home. Also, please remember that this is a cost saving per day, and so to calculate the total cost savings per patient, you will need to multiply this figure by the number of bed days released for that patient. If you would like more information, please contact Alison via the email shown.